allergen immunotherapy, acting at the core of the allergy process. Respiratory allergies often cause symptoms that affect the nose, eyes, and throat. These symptoms occur when the allergic patient is in contact with a foreign substance to the body, called an allergen, harmless to most people. Allergy negatively affects daily life, leading to disturbed sleep, fatigue, absenteeism, and poor performance at work and at school, as well as having an impact on everyday or leisure activities and social relations. Why are we allergic? An allergy is an overreaction of the immune system in contact with the allergen. The reaction takes place in two phases. The first phase is the sensitization phase. Upon initial contact with the allergen, the immune system considers the allergen as an enemy substance. The cells in the immune system, macrophages and lymphocytes, interact. Lymphocytes produce antibodies specific to the allergen, which bind to other cells known as mast cells. These mast cells are then sensitized to the allergen. The second phase is a reaction phase, which takes place when the allergen is encountered again. The mast cells sensitized to the allergen recognize it immediately and release inflammatory substances to mobilize the immune system. These inflammatory molecules are what cause allergy symptoms. Respiratory allergy is a hereditary progressive chronic disease that, untreated, worsens. Patients sensitive to an allergen often develop sensitization to other allergens over time. Allergic rhinitis may lead to onset of asthma. Can we modify the allergic reaction? There are two types of allergy treatments for treating allergies. Symptomatic treatments, prescribed as first-line treatment to relieve symptoms. Allergen immunotherapy, also known as desensitization, the only treatment to act directly on the cause of the allergy. Based on the same principle as vaccination, it consists of gradually and regularly administering the allergen causing the symptoms to patients in order to induce tolerance to the allergen. How does it work? Allergen immunotherapy reaccustoms the body to the presence of the allergen and rebalances immune response. It reduces allergy symptoms or even causes them to disappear altogether. It can also prevent sensitization to other allergens and the onset of asthma. By acting directly on the cause, only allergen immunotherapy can offer a long-lasting effect. Only allergy specialists are able to assess relevance of allergen immunotherapy. Specialists first of all conduct an allergy assessment, which involves clinical history taking, in-depth diagnosis by skin tests, and blood tests where applicable, to determine which allergen the patient is sensitive to. Allergy specialists prescribe the most appropriate treatment on the basis of the patient's allergy assessment. Allergen immunotherapy can be administered in two ways. The sublingual route, common today, whereby patients at home place drops of a solution or a tablet under the tongue. The subcutaneous route, whereby patients in a medical environment receive regular injections. Who can benefit from allergen immunotherapy? Allergen immunotherapy is indicated in subjects with allergic rhinitis or mild to moderate asthma, where symptomatic treatments are insufficient. It can be started as of the age of 5 years. When to start allergen immunotherapy? In the case of seasonal allergies, such as pollen allergy, the treatment can be started a few months before the start of the pollen season and continued during the pollen season. The treatment can then be discontinued and started again the year after, following the same protocol. In the case of perennial allergies, such as allergy to dust mites or animal hair, the treatment can be started at any time of the year and it is taken continuously. For long-term efficacy, the treatment must be taken for at least 3 years or 3 consecutive seasons. Allergen immunotherapy, by acting on the cause of the disease, reduces allergy symptoms as of the first few weeks and improves the quality of life of